Hello dear colleagues, my name is Alexander. I am a doctor and also leading expert and a member of company Tehnodent. I help medical practitioners to choose the best possible materials for daily medication. In this video I would like to talk about materials named Ftor Lux. Top result in using of our materials is highly appreciated by the dentists not only from Russia but also from CIS countries, West and East Europe, Middle Eastern countries, Southeast Asia and Latin America. For sales you could find the following materials: Ftor Lux varnish, flask 13 ml and Ftor Lux kit for deep fluoridation 10 ml plus 10 ml. Ftor Lux fluoridation varnish is used for fluoride treatment and remineralization of the dentin and enamel, and also as preventing coating and hypersensitivity of the cervical part, in hyperesthesia of hard tooth tissues, in coating of the stump of the vital tooth after the preparation, and also for the treatment of macular caries and prevention of primary teeth caries at early stage. Also, it can be used as a preventive means at the removal of orthodontic constructions, for example gap bands and brackets. For processing a tooth root after the periodontal care. For processing of wisdom teeth and protection of dental fissures during their development, and also for deep fissures of permanent teeth. Ftor Lux contains 3 active fluoridation agents: sodium fluoride 4%, calcium fluoride 4% and Aminefluoride 0.5% with a various degree of solubility, film coating and thickening agents of a natural origin, and solvents. This composition allows the fluoride film to act as a reservoir and provider of fluoride ions that stimulate the formation of fluorapatite and remineralization of hard tissues. The combination of 3 fluorides provides deep and effective fluoridation with a long duration effect. Film coating agent with a thickening agent form a restraining barrier from thermal, chemical and tactile irritants on a tooth surface or in defect of enamel. It instantly releases the patient from pain at tooth hyperesthesia at once after applying lacquer on sensitive sides of a tooth. Taking the new Ftor Lux varnish out of the box, do not worry about the thick sediment on the bottom of the flask. These are sodium fluoride and calcium in pure condition. Before applying, the flask with varnish should be shaken well for at least 1 minute for proportional distribution of the components. Before varnish application, the teeth are cleaned, isolated from saliva and carefully dried by a jet of compressed air. Varnish is applied as a thin, even layer with the help of an applicator or a brush. The varnish dries up during 10–30 seconds, forming a thin, transparent, colorless film on the surface of a tooth. If necessary, the application of the second layer should be carried out after careful drying of the first layer by a jet of an air. After procedure, it is not recommended to take food within 2 hours and to not clean teeth within 12 hours. For steady maximal fluoride effect, it is recommended to repeat varnish application in 3–6 months. Dental kit for deep fluorization of enamel and dentin Ftor Lux is used for dentin processing of deep cavities and pulp protection before filling, at preventive maintenance and treatment of primary and secondary tooth decay, macular caries, and also for preventive maintenance of caries before and after using of orthodontic appliances, for hermetic sealing of fissures without preparation of enamel, for processing the primary teeth of wisdom, and also for processing of hard tooth tissues at treatment of periodontitis. Dental kit for deep fluorization of enamel and dentin Ftor Lux includes liquids number 1 and number 2. Liquid number 1 on aqueous base contains ions of fluoride, copper and magnesium. Liquid suspension number 2 contains microatomized calcium hydroxide in the distilled water. At consecutive application of liquids with high wettability, microcrystals of calcium fluoride, copper and magnesium salts are formed in the treated dentin tubulus and in microdefects of enamel, providing deep prolonged fluorination of hard tooth tissues and a long bacterial activity. The defluorination of the prepared dentin doesn't reduce the adhesion of restoration materials and sealers. Before using the dental kit, clean the teeth, wash with water, carefully dry by a jet of compressed air and apply liquid number 1 well. Wait 1 minute for deep infiltration. Dry the tooth slightly for liquid concentration and apply rubbing liquid number 2 containing calcium hydroxide into the prepared surface. Wash the surface in a minute with the water. For fastening the achieved effect, the procedure should be repeated in 1–2 weeks, and further it is necessary to carry out 1–2 times within 1 year. For processing of the prepared dentin, use the above described technique of application. For processing deep cavities, with a thin layer of a perforated dentin, and also for application on the pulp of a vital tooth, it is necessary to observe a sequence of applying of liquids strictly. At first, put rubbing in defect liquid suspension number 2 with calcium hydroxide for protection of the pulp. Wait within 1 minute and process by liquid number 1. Then dry surface within 1 minute and again process by liquid number 2. After processing of a deep cavity, carry out planned manipulations on restoration, etching and further procedures of a surface priming, applying of adhesives and restoring. At the treatment of periodontitis, hard tooth tissues of a subgingival part are processed consistently by liquid number 1 and liquid suspension number 2 for defluoridation. A gingival pocket is additionally processed by liquid suspension number 2. Then, without washing, it is necessary to fix gingival tissues with a temporary bandage before the next visit in 5–7 days. At the next visit, the doctor will estimate the efficiency of the treatment and will administer the following treatment individually. For reduction of the cervical zone sensitivity after cleaning with the help of a brush and careful drying of a tooth with a warm air, the cervical zone of a tooth is moistened during 30 seconds plentifully with the help of the cotton ball impregnated by liquid. Without intermediate rising, the cervical zone of a tooth is also carefully moistened with calcium hydroxide during 30 seconds, slightly rubbing in a zone of the defect. After that, the procedure of washing of the processed surface is performed. After double recurrence, in 1–3 weeks, it is necessary to repeat the procedure 1–2 times per 1 year. There is a perception. The more expensive material is the better one, and I fundamentally disagree with that. The price of the final product, regardless of its quality, can be different. Company Tehnodent carefully selects raw materials and provides multi-stage control of its quality. All the production is carried out on the modern, high-quality equipment according to our developed recipes. All the technology of production, packaging and storing smoothly running to the perfect condition, providing absence of economic losses. We do not make extra charges, placing on the market the high-quality dental material that meet all international requirements for a fair price. Personally, I would like to recommend you for the daily administration the cost-effective materials from trusted manufacturer with the most convenient form of issuance. Finally, I would like to say, do not forget to talk with the dentist on which opinion do you trust. For sure, they have tested the different materials and with pleasure share with you the observations. I wish you pleasant work and smiley patience. Sincerely yours, Alexander.